The lifestyle of an elder depends significantly on their degree of frailty. Now, frailty refers to having physical disabilities, cognitive and or psychological disorders, and just chronic health conditions, being very ill. And frail adults tend to have difficulty with activities of daily living. These are just those basic self-care tasks, like cooking and cleaning and so on. Frailty also, however, refers to what we call instrumental activities of daily living. So these are tasks that require a high level of intellectual competence and planning, like going on a shopping trip, for example. They have to, make a plan of what to buy and then go in a particular order and remember where things are and so on. So frailty is not just a physical thing, it's also a mental thing. And the fact is when people reach old age, they are going to be much more prone to these kinds of health and mental health concerns. Frail older adults are just more likely to have different kinds of mental disorders like anxiety and depression, especially if they are so frail that they can't take care of themselves independently anymore and they find themselves in a long-term care facility. And like I mentioned, as a person grows older, the degree of frailty does tend to go up. And we see this go up faster for females in all ethnic groups, especially Africans, not very much for Asian groups. And one of the biggest concerns of frailty is what kind of house you're going to live in. Now, the U.S. Census Bureau defines a household as an individual who lives alone or a group of individuals who live together. And it's a very broad definition, but that's government stuff, I guess. Now, 33% of households do include a person over the age of 60, and 20% of households include a person over the age of 65. So most elders are still living with their family in some regard. But some elders, they aren't able to have that kind of life anymore. They have to move into a more specialized kind of care facility. And then there's this small percentage of these adults who are unfortunately homeless. The sad thing about homelessness in elder years is that it's typically short-lived. The mortality rate for homeless elders is very high. And a big part of this is because a lot of them are mentally disordered. They have severe mental health and or physical problems, which is partly the cause for them being homeless in many cases. So it's a sad state, but as I mentioned, it's mercifully short in most cases. Now, when it comes to elders looking for good living arrangement, what we generally see is it depends on their functional health. And now, functional health is conceptually the opposite of frailty. If a person has a high functional health, then that means they can perform those activities of daily living. They can perform those instrumental activities of daily living. So as functional health goes up, frailty goes down. They're just opposite terms, basically. Now, depending on their functional health or frailty, the different options that they will, be able to choose from include independent living situation, assisted living facility, a nursing home, and then there's a wide range of new ideas out there, like these emergent housing arrangements that they might want to look into. So most elders, most people want to live independently. Independent living situations are preferred because they allow the person to live the kind of life they want to live and allows them to stay in the house that they've lived in perhaps for their entire lives. Like they've developed a sense of place. They've developed a connection not just to that town or that street, but to that particular house, and they want to stay there. It doesn't matter if it's not the best house for them, they feel a connection to that house and they want to stay there. They've put a lot of emotional and cognitive attachments that transform that house into a home. And many individuals, they can continue to do this while still living with family. You know, that's how it works in a lot of communities, especially a lot of like Hispanic communities, for example. They tend to live together under one roof. And that is typically perfectly fine in that culture. But for elders from a more Caucasian background who, you know, Caucasians tend to put a lot more emphasis on living independently of your family, then these options where they would move in with their family or they would go to a nursing home, these are generally seen as very negative things. So what a lot of individuals will do for these elders who are living alone is they'll seek out to make some modifications. You know, like maybe they'll add a stair lift or any other number of modifications to just make that home easier to navigate and interact with, you know, in response to increases in their frailty. But if their frailty increases to such an extent that they can't really be independent anymore, the best option for them is probably going to be an assisted living facility. So these are supportive living arrangements for people who need assistance with their functional health, but they don't need 24-hour care. You know, it's not like they're going to be on life support or anything like that. It's just maybe they're a bit forgetful, or maybe they have trouble moving around. In fact, 67% of people in these facilities are over the age of 65, and they have at least one functional health limitation. And half of them have memory problems. So assisted living facility can be great for somebody who has, you know, relatively minor frailty issues, functional health problems. But if the situation becomes more severe, if they're a lot more dependent on other people, then a nursing home is probably going to be the best option. So this is a type of long-term care facility that provides medical care 24 hours a day, 7 days a week, using a team of healthcare professionals that includes like on-call physicians, nurses, therapists, and others. And about 5% of our elders live in nursing homes, and 15% of people in the oldest of the old, that fourth age I mentioned in a previous video, so 15% of the oldest old live in nursing homes. Now, there's a lot of negative stigma about nursing homes. It's probably partly due to the media's presentation of what a nursing home is and how they work. But the fact is, nursing homes, they're carefully regulated by our government. The U.S. Department of Health and Human Services has put forth something called the Nursing Home Quality Initiative to just make sure that these elders are getting adequate care. But if a nursing home doesn't sound appropriate for you, then you would perhaps want to consider one of these new ideas out there. There's a lot of emergent housing arrangements that are becoming pretty popular, such as the Eden alternative. So this is a kind of living arrangement that focuses on keeping elders socially engaged. You know, maybe they suffered from the loss of a spouse or whatever, but the point is they try to get these elders together. So think of like a community under one roof kind of a situation. So it focuses on eliminating loneliness, eliminating helplessness and boredom. It doesn't just bring them together, it gets them involved in activities. Then there's the Greenhouse Project. Now you can think of this as basically like a small neighborhood. Think of like 6 to 10 residents living in close proximity who receive a high level of personal and professional care. So it's kind of like living in a small gated community with people who are just around to help out with things. So you're not being forced together, you're not being, pushed into certain arrangements, but if you need help, there's somebody nearby who can help you out. And then there's the Pioneer Network. which focuses on making nursing homes more like actual homes. So it kind of focuses on that home idea of the nursing home. And you'll have to look this up yourself because, there's a lot of good examples online, but it really doesn't look like a nursing home. When you think of a nursing home, you think of like a hospital, basically. It's got the word nursing right in it, and that's what you would expect to see, like nurses walking around in hospital equipment. But this Pioneer network, it doesn't look like that at all. People are in their casual clothes. It looks like somebody's house. It's kind of a weird, biggish house with lots of people in it, of course, but it looks like a place that you would want to just live. It looks like a home. So they're just trying to change the approach while providing the same level of care that you would get in a typical nursing home. But a lot of that stigma I mentioned about nursing homes earlier, a lot of that comes from this idea that elders are being abused in these places. Now, it is true that elders do get abused. Unfortunately, about 1 in 4 elders, about 5 million people, are being abused or neglected in some way. And there's many different kinds of abuse. The most common kind of maltreatment of elders is neglect, where the caretaker just fails to provide support. But there's many other kinds, such as physical abuse. That's the second most common. This is where for 16% of cases. And then the third most common would be financial or material abuse. The improper use of funds and assets. We see that in about 12% of the cases. Other forms of abuse, like emotional abuse, abandonment, sexual abuse, thankfully we don't see these very often, at least not compared to neglect and the other two I just mentioned. But when it comes to where this abuse is happening and who it's happening to, it's actually not at all like a lot of people think. A lot of people have this idea that, grandma or grandpa is being mistreated by these medical professionals or whatever. But the truth is that most of the time, the abuser is a family member, if not the child of the elders. So yeah, there's a lot of research on this, but it does seem to be that in many studies, most of the abusers are related in some regard. Now, just to change the subject, because obviously this is a pretty depressing thing to talk about, and focus on providing health and medical care for these individuals that are in their old age and do tend to have some frailty issues. We do thankfully have a program called Medicare to help pay for a lot of these bills, because it can be quite expensive. I'm sure you've heard of Medicare before. It's a very well-known program. But you probably don't know much about the specifics. Medicare is funded by our payroll taxes, and its coverage consists in 4 parts. So I'm going to try to explain this as best as I can, but it doesn't really make a lot of sense to me. It's a little bit confusing, as a lot of government stuff is. But I'll just explain what it is to the best of my ability. So the coverage consists of 4 parts. Part A refers to inpatient hospital services, skilled nursing facilities, and some home health and hospice care options. Part B refers to the cost of physicians, outpatient services, medical equipment, and supplies. Part D refers to just some prescription costs. So if you need to get a prescription, then you might be covered under Part D. Now, I skipped over C because C is the weird one. C is something that we call Medicare Advantage. And this is a kind of supplemental Medicare-approved coverage that often combines coverage from Parts A and B and usually D. Like I was saying, this doesn't make a lot of sense, but this is how it is. So we have these 4 different parts to Medicare. And if you are eligible for Medicare, you must be at least 65 years of age and a U.S. citizen or a permanent legal resident. And you must have done either one of the following: worked long enough to be eligible for Social Security. So if you have your entitlements for Social Security, then you'll also have access to Medicare. Or alternatively, if you get railroad retirement benefits, that's another indicator that you have access to Medicare. Or the other one is that you could, if you worked in the government and you have not paid into Social Security, but you have paid into Medicare payroll, then you will have access to it in that way. So for most people, simply being over the age of 65 and having worked for a good portion of your life, being a US citizen, like that's going to make you qualify for Medicare as it currently is.